So New South Wales recorded the 2 locally acquired cases of COVID, and I'll go into more detail about those cases, but there were also 9 new cases were acquired overseas to 8 p.m. last night, and 1 previously reported case has been excluded, bringing the total number of cases to 5,327. There were 11,579 tests in the period. Now, if I just now take you through the cases, so just to recap, we announced yesterday there was a gentleman in his 50s that had come back as a locally acquired case of COVID. Testing of close contacts, there were approximately 10 close contacts of the case. 1 household contact has come back as positive, but the 9 other close contacts have come back as negative overnight. The person who came back, the household contact who came back as positive, had a very, very high CT value yesterday, and that shows that person is in the early phases, or it could be the end phase. But today, the person has cooperated and got for another test and we thank that person greatly for that cooperation. And that's shown that her infectious level has actually increased. So that means that we've picked up that person very early in the infection, which is consistent. In terms of the contact tracing, we have reached out to the venues that we indicated yesterday afternoon, and then we added a number of other venues last night, and they were related to the movements of the subsequent household contact. And I want to express my gratitude for everyone in taking those calls from public health, responding to that text messaging and getting tested. In terms of the detective work about how this case acquired, so in the absence of genomic, it was actually quite hard because we didn't have any lines of inquiry. This person had not come in contact with a quarantine or border workers, and so the genomics was pivotal. And can I just thank the work of the lab yesterday in doing that work, both across the ICPMR and also the SEALS laboratory assisted with some of the other tests related to this case. But what it showed is that the sequence from our new case matched with an overseas case who had travelled from the US and went to the Park Royal at Darling Harbour. The person was tested on day 1 and was positive and was moved to the SHA, the Sydney Health Accommodation, on the 28th of the 4th. We are exploring any, currently reviewing CCTV footage to look at whether how the transmission got from this individual to this to our case. And what we're concerned about is that there's a missing link, that there is someone that, because there is no direct contact that we've been able to establish yet between the case. As you can imagine, there's strict procedures around the person being admitted to in the quarantine facility and then transferred to our health quarantine facility. We can't find any direct link between our case. So what we're concerned about is that there is another person that is yet unidentified that infected our case. And then the hypothesis is that our case then passed it on to the household, which is what we would believe because of the greater risk in households. What we've also identified is because this person arrived on the 26th of the 4th, it really allows us to narrow down the time that our case was exposed. So usually we have to go back that full 14 days, but because of the link to the genomics, we now know that he was most likely even, taking those sequence of infections around that end of April. And so that's allowed us to identify some additional venues today where we're asking people to go out and get tested and isolate. And these are venues that he attended in that, not whilst infectious, but we are trying to find if there is a source of infection at those places. And that relates to the Fratelli Fresh at Westfield, Sydney, and F5 Pitt Street on Tuesday the 27th of April at 1:15 to 2:15, and at Bondi Beach, the Bondi Trattoria on 34 Campbell Parade on Thursday the 29th between 12:45 p.m. and 11:30 p.m. And as you'd be aware, those dates precede when we believe the gentleman was infectious, which was from the 30th of April. So can I thank everyone for their cooperation? Obviously, as I said, we have also had the Marrickville sewage test positive, and we can't find an obvious source for that. Now, obviously, people do move around, but given this concern about the local transmission, it has made us even more heightened in our concern about sewage detections. So the catchment serves about 42,000 people and takes sewage from the following suburbs: Dulwich Hill, Marrickville, Summerhill, Lewisham, Ashfield, Haberfield, Petersham, Lilyfield and Leichhardt. And while my message is to anyone with the most minimal of symptoms, please come forward and get tested, we're particularly calling out those suburbs because of that detection. We will be repeating the testing, and we are trying to bring forward any tests in the Sydney area to assist us in establishing the extent and scale of any transmission that we're currently missing. Thank you.